Thank you for joining me today. Thank you for joining me today. In this video, we are going to go over Seroquel. Seroquel is second generation psychiatric medication, and Seroquel is it also called a typical psychiatric medication. Second generation atypical antipsychotic medication. And Seroquel is an anti-adjunctive of a dopamine D. That is the mechanism. Dopamine D2 and serotonin receptor. So the effect is dopamine receptor and serotonin receptor. And it's second generation antipsychotic medication. It's called Seroquel. Seroquel indications. Seroquel is prescribed for schizophrenia. Schizophrenia is used this medication. Bipolar I disorder. This medication is prescribed for schizophrenia, bipolar disorder with acute mania or mixed episode, bipolar with depression. So this medication treats schizophrenia, bipolar I disorder, acute manic, mixed episode, bipolar with depression, maintenance therapy alone or with lithium or with divalproex. So it's mood stabilizer. It's also used for major depression disorder. It is also used as a adjunctive therapy. So you add this medication with other antidepressant medications. You can use with that if the patient have a major depression disorder. However, it has also off-label use. Off-label use is it's not approved. It's not FDA approved, but doctors or other researchers seen it helps, so it have been used off-label. It has a off-label uses. It improves insomnia in lower dose. I have seen older population with dementia, Parkinson, who are confused. They have insomnia. So this medication help them calm down and sleep. I have been seen prescribed to older seniors who have dementia, Parkinson, Alzheimer, people who are confused and they are elderly. It calms them down. It's also this medication treat anxiety disorder, PTSD disorder. It's mood stabilizer, so it comes the irritation and restlessness and improve his sleep. However, some of the side effects include sedation, drowsiness, dizziness. So those elderly can fall if the doses is higher, if they are fall risk. So you have to assist those things before you prescribe them. It lowers the blood pressure. It causes dizziness. It leads to orthostatic hypotension. So depending on the position, it lowers the blood pressure. It leads to dry mouth, constipation. It increases appetite and weight gain. It increases the blood sugar. It increases, because when you gain weight, it will increase all that. It increases the blood sugar, it increases the lipid in your blood. So it leads hyperglycemia, dyslipidemia, metabolic dysrhythmia. It also leads to EBS, extrapyramidal syndrome, low risk than others because it's second generation antipsychotic medication, but it also has that risk of EBS, tardive dyskinesia with a long-term use. It also leads to tardive dyskinesia, so abnormal muscle movement. This medication has a serious and black box warning. It increases mortality in elderly population with dementia. As we mentioned before, it increases the risk, mortality risk. It increased the mortality risk in elderly population with dementia related to psychosis. So not approved for this use. It increases suicidal thoughts and behavior in children, teenagers, and younger adults. It leads to neuroleptic malignancy syndrome, which is rare but life-threatening disorder. So the baseline and ongoing monitor are essential for this medication. You will monitor weight gain, BMIs, and waist circumference. You will monitor fasting glucose or A1C. You will check the liver panel when you give this medication. You will check the blood pressure and also orthostatic vital signs, not just the blood pressure, vital signs, because heart can increase or decrease. You will assess mental status for suicidal ideation, mood changes. You will assess those. You will monitor movement disorder like tear-deaf dyskinesia. You will also assist the liver function by checking the liver panel. You will educate the patient. The key counseling point for patient and families are: take exactly as prescribed for this medication. Do not stop quickly for this medication. Sedation is common for this medication. Avoid driving or alcohol use with this medication. Rise slowly from sitting position, laying position to prevent dizziness, because if you just stand up quickly, you could fall and break your bones. So rise slowly from one position to other. This medication has extended release tablets and must be swallowed whole. Do not crush or chew the medication. That's what you teach the patient. Maintain healthy diet, exercise plan to prevent weight gain and metabolic risks. Report immediately if you are feeling fever, muscle rigidity, confusion, uncontrolled movement, suicidal thoughts, severe mood changes. You have to report that immediately. You have to call your primary doctor, go to the emergency so they can adjust this medication or change it or stop it. Do something about it. Clinical borals are one of the most sedative and atypical antipsychotics. So this medication is one of the most sedative antipsychiatric medication, atypical antipsychiatric medication. Helpful if insomnia or agitation present. This is what you use for if insomnia, because some of the patients who have acute manic, they have agitation and insomnia. So this medication is good for that. It has lower EBS risks than many antipsychiatric medication, but is still monitored for long-term use. Long-term use, it can lead to that, but compared to others, it has a lower EBS side effects. Not approved for dementia-related psychosis due to mortality risk. So I have seen been used for dementia patient, but it's not approved. It's a risk for that due to the mortality risk. For extended release format tablets, swallow once daily, evening dosing. So this medication is good to be taken at the bedtime. It can help with the sleep, evening time. Start slowly and titrate slowly in orderly or hepatic impaired patient. So if the patient is orderly, so you can know how much they can tolerate. You start slowly and increase slowly, and then if also if the patient have a liver impairment, you start slowly and you see how the labs are doing. I have a case study based on Seroquel. Seroquel is a medication I think of a flexible but never casual. It's flexible but it's never casual. I prescribed it for Mr. Che. She is a 37 years old woman admitted to inpatient unit for bipolar depression with severe insomnia and anxiety. So this medication is good for that. It's good for patients who have insomnia and anxiety. She was not overly suicidal, but she was unevenly sleeping 2 hours at night. She was sleeping only 2 hours at night, remembering constantly, rumination constantly, tearful but exhausted. She was tearful and she was exhausted. She was not sleeping only 2 hours. Depressants had worsened her agitation in the past, so she had a antidepressant medication that worsened her depression and make her agitated. Mood stabilizer had helped somewhat, but sleep remains the breaking point. What I need most, she say, is for my brain to stop racing long enough to rest. So she's complaining about her brain being racing. That where the Seroquel enters the conversation. We talked about openly about what it is and what it's not. So I talked to her about what is the Seroquel is, what Seroquel is not. Yes, it is an antipsychiatric medication, a typical antipsychiatric medication used for bipolar, schizophrenia, and major depression disorder, but in a real clinical life, it often is a place because of its sedation and anxiolytic properties at a lower dose, and its mood stabilizer effect as dose climb. So it stabilizes the mood, it improves sleep, it improves anxiety. So we started low dose at night. Low dose at night. The first response was unmistakable. It was unmistakable. She slept, not lightly, deeply. For the first time in a week. The next morning she told me, half relieved and half worth. I feel quieter, heavy but quieter. So she's quiet, she feels heavy, and that is a Seroquel trade-off. Over the next several days, her mood lifted, just enough to engage in a therapy. Her thought is slow, anxiety softened, but we also monitor the cost, morning grogginess, increased appetite, mild orthostatic. I made a point of naming these effects early so they did not feel like failure of the surprises. So I mentioned these side effects early so the patient don't think this medication is not working for me. Sometimes they come and say, this medication is not working for me, this is what I am feeling. I am feeling worse than before, so I'm not going to take it. It's better to educate the patient earlier so they can know what to expect, what this medication is improves and what this medication is not going to improve. As she stabilized, we revised the plan and was Seroquel bridged for sleep and mood, or a long-term cornerstone. Was Seroquel a bridge for sleep and mood, or long-term cornerstone? Could the dose be minimized? Those are the questions to ask yourself. Were there a metabolic risk we need to track, like the weight gain, glucose, lipids from day one? So you check their baseline because you want to know how the medication is increasing their weight, or so you check their weight, you check their glucose, check their lipids before you even begin the medication, and then you check later to see if the medication is affecting their weight or their glucose or their lipids. That's how you track the effect. This question is matter because the Seroquel is the medication that can quietly extend its footprint if not one keeps watching. That's why you want to watch. Before discharge, she say something that has stayed with me. So this patient say that. I did not fix everything, but it gave me just enough rest to try again. That's what the patient say. That when a Seroquel feels most appropriate to me, not as a blunt instruction, but as a regular, helping the nervous system slow down enough for recovery to begin. So that is the reason you use it to calm the nervous system slowly so the patient can begin the recovery. Seroquel teach me this. It is strength. It's not just what it treats, but how adaptable it is across the phases of an illness. That the adaptability requires intentional dosing, regular reassessment, and clear exit strategy. Use thoughtful, it can restore sleep, reduce stress, and stabilize mood. So this medication, it restores the sleep, reduces the stress, and stabilizes the mood, but use cautionly. It can linger long after its benefit is needed. So my question to you is, when prescribing a Seroquel, how do you decide whether it is serving as a short-term symptom relief or long-term mood stabilizer? Think about that question. How do you prevent a dose creeping or passive continuation? How do you prevent that? Those are my questions to you. Thank you for joining me today. I would love to see you in my next video.